Hello and welcome everyone. Today we are learning about plasma cell neoplasm. Plasma cell neoplasms are a family of disorders characterized by clonal proliferation of plasma cell. Plasma cell is activated B cell which secretes antibodies. This is an introductory lecture include etiology, clinical features and definitions of plasma cell neoplasms and molecular cytogenetics of multiple myeloma. Spectrum of plasma cell neoplasm includes following. First is mgus, that is monoclonal gammopathy of undetermined significance. Second is SMM, that is smoldering multiple myeloma. Third is multiple myeloma. Plasmacytoma, either solitary or extramedullary, heavy chain disease, Waldenstrom macroglobulinemia and systemic amyloidosis and Poems syndrome. The hallmark characteristic of plasma cell neoplasms are histopathologic conformation of excess clonal plasma cells and excessive production and secretion of intact monoclonal protein M spike or free light chains in serum or in urine. Plasma cell neoplasm can be pre-malignant such as monoclonal gammopathy of undetermined significance or malignant. Example is multiple myeloma. Etiology of plasma cell neoplasm is not known, but the possible risk factors include environmental factors such as radiation exposure, occupational exposure including agriculture, chemical, metallurgical, rubber plant, pulp, wood, paper, etc. and chemical exposures including formaldehyde, epichlorohydrin, agent orange, hair dyes, paint, sprays, asbestos, etc. Genetic predisposition factors. Patients with sibling or other first degree relatives who have one of these diseases are more likely to develop it as well. Clinical features. mgus and SMM is asymptomatic. In multiple myeloma, we can find hypercalcemia, renal failure, anemia, bone disease. In plasmacytoma, symptoms of plasmacytoma vary based on the location of tumor. Plasmacytoma located in the brain, which can cause headache, seizure, paralysis, while plasmacytoma located in the rib can cause non-cardiac chest pain that is pleuritic in nature. In heavy chain disease, according to the chain involved, IgA is involved, then it is associated with digestive, lymphomatous and respiratory forms. IgG is associated with disseminated and localized disease on minority with only autoimmune disease. And IgM is associated with splenomegaly, hepatomegaly and lymphadenopathy. Poems, which is the acronym. The full form of Poems is P for polyneuropathy, which shows symmetrical distal weakness and paresthesia, impotence, Raynaud's phenomena and painful diarrhea. O is organomegaly, hepatomegaly, splenomegaly, lymphadenopathy, Castleman disease. Endocrinopathy, that is hypothyroidism, gonadal axis abnormality, adrenal axis abnormality, gynecomastia, galactorrhea, diabetes mellitus, peripheral edema, hyperhidrosis. M protein and skin changes, that is hyperpigmentation, acrocyanosis and plethora, hemangioma, telangiectasia, hypertrichosis and thickening. Now let's learn about the definition of different disorders. In monoclonal gammopathy of undetermined significance, the serum monoclonal protein is less than 30 gram per liter. FLC ratio may be abnormal. Urinary M protein is less than 500 milligram per 24 hour and clonal plasma cells are less than 10% in bone marrow. And organ damage such as hypercalcemia, renal insufficiency, amyloidosis and bone lesions are absent in mgus. In smoldering multiple myeloma, the serum monoclonal protein is more than or equal to 30 gram per liter. FLC is abnormal. urinary M protein is more than 500 milligram per 24 hour. Clonal bone marrow plasma cells are 10 to 60%, but the difference between multiple myeloma and smoldering multiple myeloma is that the end organ damage is absent in SMM and which is present in multiple myeloma. Other lesions are present on multiple myeloma in MRI, and biopsy proven bone lesion and soft tissue mass can be seen in multiple myeloma. In solitary plasma cell lesion includes clonal bone marrow plasma cell less than 10% and organ damage is absent. Lesions on MRI is absent except for the primary lesion, and biopsy proven bone lesion or soft tissue lesion is present. In the plasma cell leukemia, all the criteria of multiple myeloma is present, plus there is a more than or equal to 5% plasma cells in the peripheral blood. Now let's learn about the molecular cytogenetic classification of multiple myeloma. First is hyperdiploid multiple myeloma, which includes recurrent trisomies involving odd numbered chromosomes with exception of 1, 13 and 21. Second is IgH translocated multiple myeloma, in which first is translocation 11, 14, Q13, Q32. Gene involved is CCND1, cyclin D1. Second is translocation 614, P21, Q32. Gene involved is CCND3, that is cyclin D3. Third is translocation 414, P16, Q32. Gene is NSD2. Translocation 1416, Q32, Q23. Gene is CMAF. Fifth is translocation 1420, that is Q32, Q11, and gene involved is MAFB. And there are few other translocations and other cytogenetic abnormalities. The prognosis depending on this cytogenetic abnormalities are following. The hyperdiploid multiple myeloma has a good prognosis. Translocation 1114 and translocation 614 also has a good prognosis. Translocation 414 has an intermediate risk, and translocation 1416 and 1420 has a high risk multiple myeloma. So this is in short about plasma cell disorders, and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.